Hey, it's Birdman for Summit Healthcare's, and today I've got a couple of guests with me, and we're talking about behavioral health and integrated health, right?
Yeah.
Once again, we talked about this a couple weeks ago, and I'm not sure what fell in the schedule because we've had some other things. So I always record a bunch, and then they renumber them and post them up. So, we talked to, and who was it? It was Anne and, do you
And
remember?
Jennifer.
And Jennifer. And who we have here today is Sara Hart, and I've got Kristine Roberts. And where do you work at specifically for Summit?
So I'm at Lakeside Family Medicine with Dr. Waite, and at Pine Top Family Medicine with Dr. Smithson, and then at Internal Med, where we have Dr. Ahmed, and there's also the naturopathic medicine there with Dr. Corey Kennedy.
Okay. And then you're at?
I'm at the pain clinic with Dr. Trujillo, nurse practitioner McCormick, and PA Hall.
Okay. So let's talk a little bit about what this integrated is. And this is kind of good because we've been talking over the last few years on different shows here with Birdman Media about the fact that mental health, I think at least, it should be approached the same way as physical health.
Definitely.
It's easy to see when somebody breaks an arm. It's like, oh, look, they've got a broken arm. So
Right.
you don't walk up and slap their arm. But when something's happened in the mental aspect, you have no idea. So you might come up and do an insult or say something that just triggers something at that moment when they're weaker. And it doesn't mean that they're weak or not as strong as other individuals. It just happens to be that particular thing is maybe weak with them. Is that accurate?
Sure. Certainly behavioral health issues, depression, anxiety, stress impact our physical health as well. And I think it's really difficult to separate the two. Just oftentimes people will say, well, it's in their head. Well, their head contains their brain, correct? And, mental health or behavioral health issues are just as physiological and biological as medical issues like diabetes, heart disease, things like that. So certainly keeping them integrated and together and treating the person as a whole person, I think is a really valuable service that's being offered, and that's what we're attempting to do at the outpatient clinics with Summit.
So does that play into that? We've heard the phrase mind over matter, where actually mentally you can make yourself sick or maybe accentuate the sickness or things like that?
I mean, they can definitely add to each other, yes. So just stress can add to depression, lack of sleep can add to depression, depression can add to lack of sleep. So that's where the integrated behavioral health comes in because, like she said, both the medical and the mental health play a big part in each other. And so we can definitely help address not only the mental health concerns such as depression and anxiety, but if somebody's needing help with medication management, helping to set up goals for weight loss, diabetes management, we can help work with them on that as well to tie that in with each other.
So if we say anxiety, depression, your self-worth, is that pretty much the key of what we're talking about here? Or the core?
The core. Well, certainly, I think we see quite a few individuals that have depression and anxiety, and I don't know that I would connect it back to just their self-worth. I think that that's a piece of it. I think when people are suffering from a depression or from an anxiety, it certainly impacts their self-worth and how they feel about themselves as a person and how that impacts their view.
And I probably said that wrong. I meant that as an individual thing,
got
not
it.
the thing.
Okay.
But I meant all three of those things as
yes,
the
together.
thing.
Yeah.
Okay,
Certainly play on each other and impact the way that they're even able to treat their physical medical issues too. If you're depressed or feeling less worthy, to use your words as well, it's difficult to kind of set those goals and to stay focused on your physical health, to even be motivated to get up and do the things you need to do. Make sure you're staying on your medication regimen, to make sure you're checking your blood if you have diabetes, doing the exercise that's important. All of that just makes it more difficult when you're suffering from a depression and anxiety type disorders.
And with that too, with the integrated behavior health, it helps hopefully take away that barrier of having to do multiple appointments at many different places. So if you are already having a difficult time maybe ambulating due to a medical condition, but also just lack of motivation due to depression, if you're able to see your PCP and be able to meet with a behavioral health consultant, it's one-stop shop. So our hope is that makes it easier and more accessible to patients as well.
So let me try to draw an analogy because I like to go way off tangent sometimes, so people don't bring them back to it. I always say that red lights are the reason we have road rage, because you have to continually stop
Right.
and wait, and then go, and then stop and wait. And I always say that the areas that have the highest road rage are the places that have the most traffic lights, because if you don't have to stop and wait
Right.
for stupidity, it's usually like, well, there's nobody here, why can't I go?
Mhm.
And it's just this arbitrary rule at that point where they do mean something. Same thing. It's like, if you got to go to this doctor and that doctor
Right.
and this, and I got to wait, and then of
Yeah.
course there's always the wait at the doctor. Unfortunately, that's the way it runs because people don't show up on time or they don't show up at all. And then
Right.
so you have to kind of book it so that you're able to have people
Sure.
consistently through the day. Otherwise, you'd be sitting there all day going, "Oh, awesome." So yeah, I think that's the kind of thing that helps, is when you start treating the person as a person
Mhm.
instead of a symptom,
Right.
and you're putting them all together and saying, okay, this works together. I was having a conversation with my wife the other day, and we were talking about anxiety, and she says, well, do you have anxiety about things? I'm like, I have anxiety about everything. It's not exclusive to, even when I'm coming off as completely confident and secure,
Mhm.
still in the back of my head, there's always that little, this little thing, and sure, I'm like, hey, no, so, but those play against each other.
Right.
It's just when that one starts taking over every single conversation,
Mhm.
that we can get into that not feeling good about ourselves, having depression, and the
Right.
over anxiety kind of thing.
Right, and having difficulty then managing, basic life tasks and making sure you're taking care of yourself as well as your family if need be. Having us in the provider offices as well, I think helps to decrease the amount of stigma associated with behavioral health, which is a
Mhm.
huge issue as well. But if we're there and we're viewed as just part of the medical team, as part of the team there for your full and total health, I think that also helps people feel more comfortable for reaching out for the help that they need too.
Right.
Yeah, and hopefully talking about this and explaining that everybody has anxiety, that because some people are like, oh, these people don't have. No, everybody,
Mhm.
if you're human, and in order to stay alive, we have to have
Mhm.
anxiety.
Right.
Otherwise, we would do things like walk out in front of traffic.
Right.
Not a good idea.
So, that has to exist for us to be healthy. A certain level of anxiety is healthy.
Right.
So it's when it gets out of balance, much like your maybe it's your digestive system is, or you break a bone or things like that.
Mhm.
So, what other things do you want to make sure people understand as far as how this is doing, and what it does for them at other levels of care?
Sure. Well, I think that it's been going amazingly well, actually. I think that it's been well received by
Mhm.
the providers as well as the patients. Sometimes the feedback that we receive before we go into the exam room to meet with the patient is that they might be a little nervous, or maybe, no, I really don't need to talk to behavioral health.
Anxiety.
Right, right. And then once we go in and they meet us and they see that, we're just, regular people who care,
Right.
they relax a little bit. And by the end of those meetings, frequently, oftentimes, more times than not, they are grateful and thankful that we were able to go in and meet with them. Their stress level has decreased. We've been able to give them a couple tools, or set up some follow-up sessions to continue to
Mhm.
assist them and help them. And it's been very, very, I think, well received by the patient population.
How long have you been doing this, or really focusing in on the integrated?
Just since
Mar-
March, yeah, we started
Okay.
in March, and it started with the two of us, and so now there's four of us. So our hope, we would definitely like to continue to expand. But yeah, just since March, so not too long yet, but it's been going good so
I mean,
far.
I've always said that sometimes that's the reason that nurses are actually probably more important in healthcare than the doctors. Sorry, doctors. But the reality is, because they have that compassionate level, and they have always sort of balanced the emotional side, or the mental side to the physical
Mhm.
side,
Sure.
where the doctors, and they get picked on, but they are the numbers kind of person. They come in, they look at the
Right.
numbers, they see what they're
Right.
online, and they come in and out.
Well, and it's nice too because it allows the doctors to have some of their time freed up a little bit so they can get on to their next patient. So if a patient comes in, they're able to discuss all their medical concerns, and even mental health concerns, but they need some more resources or a little bit extra time after the doctor has addressed those medical needs. Then we can come in and assist with whether it's resources, getting them connected, scheduling follow-up visits, and the doctor is able to go on to their next patient. So it helps with that time management too for patients and the provider.
So, are you expecting to see people getting healthier or out of situations faster because of the integration of the healthcare?
Yes, I think so. Research has shown, I think it's about what 70% of the reason that individuals end up in their primary care physician's office is due to some behavioral health concern, but it's not necessarily, they're not calling up and saying, "Hey, I have anxiety, I need to schedule an appointment." It's something else manifesting that ends up being connected to maybe the anxiety, the depression, the stress, that kind of stuff. So if we can help work with them on those issues while the provider, the medical provider, is working with them on their medical concerns. The goal would be hopefully that they would be healthier,
Mhm.
get healthier, have a healthier lifestyle along with that.
Very good. Any final thoughts from either one of you?
I don't think so. I think that just another added to it is that even if they're not necessarily needing a follow up or traditional counseling or whatnot, we can also just help connect with resources.
Mhm.
So make referrals, whether it's to Arizona Long Term Care, NACOG, Change Point, Public Health Services. So that's another another addition
Mhm.
that we can add
Very
as
good.
well.
Awesome.
Yeah, I'm good.
Okay, so once again, it was Kristine Roberts and Sarah Hart with Summit Healthcare
Mhm.
in the integrated health. It's not really a department. It's and which is kind of
Integrated
cool
behavior
because it's
health.
integrated
Yeah,
Yeah.
behavioral health. It's just
exactly.
integrating in and treating the entire person.
Yep.
Exactly.
Thank you very much,
Thank you.
Thank you.
Ann Birdman, and this is Summit Healthcare. So I'm going to remind you, be healthy.